Okay, ma'am.
Okay, so if you've read and understood, considering its surgical anatomy station, please help me and identify okay, these structures, which is number 10.
Number 10 is the midbrain.
Okay. Right. What is 9?
Cerebellum.
Okay. 18, please.
18 is the corpus callosum splenium.
Okay. What is 14 over here?
14 is the septum pellucidum.
You're not sure. Are you
Fornix.
sure?
This is fornix.
Okay. What is 11?
11 spinal cord.
Okay. And what is 16 here?
Medulla.
Say it complete. Medulla oblongata.
Medulla oblongata.
Yes. Please tell me. Okay. Please tell me how cerebrospinal fluid is formed.
Can I answer it later?
Okay. Or you have not revised that. Okay. Please tell me, what is Arnold-Cherry malformations and how would you identify that on MRI?
In case of when this is a disorder where tonsil of cerebellum gets herniated through the posterior aspect of the foramen magnum, and in MRI this will be evident by seeing the tonsil at the posterior aspect of the foramen magnum behind the middle oblongate.
Please tell me again. I don't think it. Okay, it's a downward displacement of the cerebellar tonsils through the foramen magnum, causing non-communicating hydrocephalus.
Hydrocephalus.
And it results in obstruction of
Obstruction of the
CSF, cerebrospinal fluid outflow. And cerebral tonsil at position, it says 5 millimeter of cutoff, is measured relative to the Bayesian opposition line. That is the using sagittal T1 MRI image. Okay, right. How many cranial nerves are there?
12 pair.
Yes, be confident. Okay, right. Which are the cranial nerves with parasympathetic fibers?
Oculomotor nerve, facial nerve, glossopharyngeal, and vagus nerve.
All right, good. Okay, if you could identify. Okay, what is tentorum cerebelli?
This is the fold of dura supporting the temporal lobes of both cerebral hemisphere on both sides.
Okay, and in its relation, what comes? I want to know the structures, important structures which come in relation to tentorum cerebelli.
On posterior aspect, transverse, it allows the passage of transverse sinus on both sides, and
no, internal carotid artery, optic chiasma, and cranial nerve 2 and 3 are also in its relations. Okay, please tell me how many. All right. Okay, I want you to tell me. All the messages are coming now. Okay, please, I want you to tell me about the formation of the middle or the boundaries of the middle ear.
boundaries earlier, behind is bounded by the mastoid ear cell, and laterally is bounded by the tympanic membrane. Anteriorly, thin plate of bone separating it from the
Okay, we'll revise this later. Tell me what passes through the roof of the middle ear?
Tegment tympani.
Okay, how the infection from the middle ear crosses the skull?
It may spread through direct invasion, spread through the bone, and it may spread through the emissary veins, thrombosis of the emissary veins, and through the nerve plexus.
Through direct erosion of tegment tympani, it also spreads through mastoid ear cells, causing mastoiditis. Okay, please tell me which vein drains the dangerous area of the face?
Ophthalmic vein and facial vein.
Inferior
ophthalmic vein and facial vein.
Please tell me how would you differentiate between upper motor neuron lesion and lower motor neuron lesion in facial palsy?
In upper motor neuron lesion type of facial palsy, there will be sparing of the upper face due to innervation from both sides of cerebral hemisphere. And in lower motor neuron type of facial palsy, there will be involvement of the ipsilateral face, both the upper face and lower face.
Okay, good. Right. If you could tell me. Right. Oh, okay, because I did not show you that subarachnoid spaces or cisterns. How many are there? Or what are these?
Cisterns there, these are spaces where CSF collects from the subarachnoid space, and there are several cisterns. The largest is the cisterna magna, then the prepontine cistern, interpeduncular cistern, suprasellar cisterns. These are several cisterns.
Okay. Right. If you could also tell me. Structures on which the cranial nerve 3 is pressed against.
This is
petrous part of temporal bone.
Petrous part of temporal bone.
Okay, good. Thank you.